and up until that time, is gear that is allowing our necks to be uncovered. And I just flat out asked several infectious disease nurses, I asked the CDC, why? Why would I be wearing 2 pairs of gloves, 3 pairs of booties, a plastic suit covering my entire body, and then leave my neck hanging out this much so that something can potentially go close to my mouth or nose?
I'll never understand that. Joining us now is certified family nurse practitioner and founder of MidlevelU, which is an online source for family practitioners. Erin Tolbert is with us. Hey, Erin, good to see you.
Hi, thanks for having me.
My pleasure. All right, first your reaction to that. I mean, how is that? And I heard the head of the CDC say to Megyn Kelly that he would have part of his neck exposed and even part of his feet exposed. And this was just like a week ago. I'm thinking, what on earth is he talking about?
Right. Well, and then you see pictures of him also when he visited West Africa. He's wearing the full yellow bodysuit. And this is just an example of some of this misinformation we've been given by the CDC and this whole process. And even on the CDC's website, they address the question of why you don't need a full bodysuit here. They said it's because we're not dealing with dead bodies like they are in West Africa. However, now they're backtracking. They're saying that wasn't the case. We're sorry, but unfortunately it's too late here.
At first they came out and said that the protocol wasn't followed by this first nurse who caught it. Turned out there was no protocol. Were we, in your view, totally unprepared, notwithstanding assurances to the contrary months prior, totally unprepared for a case to come up somewhere in the USA?
Completely unprepared. You saw when we brought the patients over from Africa to be treated at Emory, they thought about it for days. They brought them over in these special biocontainment units. There was clearly a protocol there. And so when this patient showed up in Dallas and the CDC said, hey, don't worry, everyone can treat Ebola, clearly it wasn't the case. Nurses knew it wasn't the case. 60% of nurses said, hey, we have no idea what we're doing here. No one's ever taught us. And you can expect a little bit of a learning curve, but it was quite obvious that any hospital was not prepared to deal with Ebola. First and foremost, it's the CDC's responsibility. We need somebody with the information, the research on this disease to deliver that information to tell us what to do when it comes to how to treat it in our hospitals. Then once that information gets to the hospital, it's the administrator's responsibility to deliver that to the nurses, to the doctors, to the nurse practitioners. But we never got to that step. We didn't have that information given to administration in the first place, so we couldn't get to step number 2, which is getting it to the healthcare providers themselves.
Do you believe that the nurses in Dallas, the reason those patients were moved is that they wouldn't and no longer treat Ebola patients? I mean, I wouldn't blame them if that were the case. Do you know that, or do you suspect that?
I don't know that for sure, but I really can't see a case where healthcare workers would refuse to take care of a patient, especially one of their own. I think that people are willing to take care of these patients, but I think that it became very clear very quickly that this hospital in Dallas was not prepared, and finally the CDC did the right thing. They transferred this patient to a biocontainment unit, to people who were prepared to deal with this, who'd practiced taking on and off that protective gear, as opposed to nurses who weren't, given that information initially. I don't think it was a lack of cooperation on part of the healthcare providers themselves.
I know you're not a doctor, but are you confident that this 21-day incubation period is accurate? I mean, you know better than I how they came up with that or how they would come up with that. Are you secure in that in your own mind?
I am, and we've seen, a lot of people with Ebola in Africa. We do have some research on the Ebola virus, and we know that most people get sick within about 8 to 10 days. However, you can get sick up to 21 days, and so I am confident in that. There's been some talk of could the virus mutate? Well, of course, any virus can mutate, but we haven't seen that yet. So I'm comfortable saying if you haven't gotten sick within 21 days that you won't come down with the virus.
Are you comfortable and confident in your position as an emergency room nurse in Tennessee going forward? I mean, are you scared that you might come down with it?
I'm not scared. The chances of it coming to my specific hospital are still very, very low.
But if it did?
But if it did, I would certainly be concerned. We're getting there. We don't have all of the protective equipment we need yet. We're starting to get these protocols in place. I actually just got an email this morning about here's our Ebola protocol. I've been looking it over this morning. It looks great. It protects the patients in the waiting room. It protects the nurses.
But you also need the suits.
Exactly, exactly. And so we've got to get that equipment, and we've got to practice these protocols too. You can't you know, say here's what we do in a
Right,
fire drill
and never practice
do a
it.
fire drill.
How can
right.
people find out more about MidlevelU if they're in the business or whatever? Is there a website?
Yes, MidlevelU.com. It's for nurse practitioners, everything from education to career issues.
Great. Great to see you.
Thanks
Thank you
for
so much
having
for
me.
coming by. All right, folks, so before we go, I want to thank Erin Tolbert. Should the U.S. ban air travel from West Africa? Go to newsmax.com/polls and cast your vote now.